Okay, hello and welcome back to COVID-19 Reality for our third installment. In this installment, as you see on the story on our very high-tech screen here, we're going to be discussing the the NBC News story that was reported July 1st on the internal messages revealing crisis at Houston hospitals as coronavirus cases surge. This was a particularly interesting article. I have some unique viewpoints on it. And so basically what I'm going to do is I'm going to read excerpts from the article as we go along in the narration. I'm going to try to keep this a little shorter than usual. I've been running a little long, but let's get started. So as you can see at LBJ Hospital on Sunday, and that would be June 28th, according to when the story was printed, the medical staff ran out of both spaces for new coronavirus patients and key drugs needed to treat them, particularly remdesivir, is what I read in an alternate version of the story. With no open beds at the public hospital, a dozen COVID-19 patients who were in need of intensive care were stuck in the emergency room awaiting transfer. So, this is LBJ is a public hospital. University of Texas Medical Branch is another public hospital that's in Galveston. Ben Taub is the official Houston public hospital. So it would be Ben Taub and LBJ is the two in the quote-unquote Houston area. A day later, the top physician executive at Houston Methodist Hospital Systems wrote to staff members warning them that the coronavirus caseload was surging. And this following is a quote: "It has become necessary to consider delaying more surgical services to create further capacity for COVID-19 patients." The note was an abrupt turnaround from 3 days earlier when the same hospital system sent a note to thousands of patients inviting them to keep their surgical appointments as scheduled. Now we're going to come back to that. That will be a salient point in a few minutes, and actually a very salient point of something they assert in the article. So going on, another interesting note is that MD Anderson Cancer Center, a world famous cancer center here in Houston, they will now be taking cancer patients with COVID-19 who are COVID-19 positive from the city's overrun and overburdened hospital system. This is basically an unusual move. People don't come to MD Anderson for anything other than cancer care, but now they're kind of double stacking the deck since we're having overflow. Also, Texas Children's Hospital here in Texas, another world famous hospital for children, had begun taking adult patients, I think a few weeks ago at this point. Not very long, but they have been. That is unusual for them in this capacity. They do actually run. About 5 years ago, they created a complete system for OBGYN. So kind of basically have your child and get your care, prenatal care, and afterwards and everything. So, but for adult COVID patients, that is unusual for them to do this. So, hold on, going here. Highly unusual move. Okay, so we do have here. Hold on. We do have a couple of quotes I do have right here. This basically they were saying that one of the officials from Memorial Hermann was saying that he wasn't worried about the current week that he was in, but the next week, which would be the week that we're coming on now. This is the Monday of the week he was speaking about, was going to cause issue. I think I had something that somehow I deleted it. Sorry about that. I'm reading from the script here. But another quote, just to let you know. So we're basically I'm giving these quotes to let you know that other officials outside the CEOs of these hospitals are expressing concern. This quote here is particularly damaging. The time to act and the time to be alarmed is not when we've hit capacity, but it's much earlier when you start to see hospitalizations increase at a very fast rate. The quote goes on to say, "It is definitely time to take that kind of action. It's time to be alarmed." That was a quote said by Lauren Ansel Myers, a professor of integrative biology at the University of Texas Austin COVID-19 Modeling Consortium. So again, the quotes are just meant to give you kind of point out the inconsistencies. That the CEOs from the medical center were saying that everything's fine and we have plenty of room and we have all these plans, which I'm sure they do, but saying that everything's okay is not exactly reassuring or accurate. Experts caution that the rising hospitalizations today will likely result in a spike in deaths in the coming weeks, because death is a lagging indicator in all these things. So, and that those who require ICU care for COVID-19 but recover often have, after leaving the hospital, often have lingering conditions. And this will be a subject of another video I'm going to be doing soon concerning long haulers, as they're known. These are people who, in many, many cases, have had their symptoms persist for 3 months after they quote unquote recovered. But we'll get to that another time. Ms. Myers, who was the professor again at UT, she goes on to say that Myers and others said that while hospitals across the United States, generally speaking, are more prepared than they were back in March and April when this first hit, they have things like more PPE, which I'm going to get to in a second, advances in therapeutics and ventilators. It's still, they're grossly overwhelmed simply because the government isn't helping us out. That's a big disadvantage. Now, I'm going to take a quick sec order here, and the personal protective equipment, as of June 10th, I believe what I have here, I'm still seeing that there isn't enough, and there's actually several issues for this. Firstly, the story that I read cited that the manufacturers are increasingly facing a critical shortage of raw materials for the PPE, such as the materials for the respirators, 95 respirators, and polypropylene for isolation gowns. Secondly, after successful production and strict quality control, basically there are these heavily imposed regs that prevent them from giving out large quantities. Because we've run short before, they're kind of rationing out only a few here and a few there, sometimes triaging it to what's needed. Thirdly, getting PPE from the rest of the world is a little hard because a lot of governments have kind of just said, no, we're saving it for our own people. So it's an interesting story. We go on, and you can read the article for yourself. I just want to do a couple more quotes here. But the hospitalizations you see today, they're not going to linearly increase in the next several weeks. They're going to accelerate. So we're not going to see a 1-to-1 ratio on these evenly. We're going to see a jump in the hospitalizations, and then after that, after a certain amount of time, the deaths. Then again, that's going to be a little harder with this younger population. They may linger in the hospital. Luckily, they may not result in a lot of deaths, but sometimes people don't. Sometimes people get COVID and they die quickly, and sometimes they don't. Just like the Broadway performer who took 3 months. The guy was just incredible. He had a lot to live for, and it just overtook him. What I want to do now is I want to move on to my major point for this video. So on June 24th, several hospital executives affiliated with Texas Medical Center issued a statement warning that COVID-19 hospitalizations were growing at a, quote, alarming rate and could soon put an unsustainable strain on hospital resources. Okay? Now, the following day, after Governor Abbott issued an executive order directing hospitals to limit elective surgeries, a measure which was intended to, preserve hospital capacity for COVID patients, the CEOs of 4 of the major hospitals in the medical center abruptly dialed back the earlier warning that they had given. They said, they put together a hastily organized news conference, and they went on to say they didn't mean to alarm the public. The hospital still had plenty of room in ICU beds, and they said beds to both treat COVID-19 and continue caring for the patients. That's nice timing. Okay, they state that there's a situation, then the governor puts his order down, and they reverse it. So basically, it's something you should know, that hospitals in Houston and elsewhere during the first part of the pandemic in March and April, they shut down, and that move basically hurt their revenues because, as it turns out, elective surgeries deliver a far higher financial return than ICU wards full of COVID patients. So what does this all mean? You're probably asking yourself, okay, so the government ordered them to not have any more elective surgeries. What can they do? Okay, and this is basically, they changed their story. Who cares? It's a state order. You would be wrong on that. So let's go ahead into our first document on the screen here, and I will show you the actual order that the governor put out. Oh no, hold on. I have it up here. Okay, so this is the official with the seal of Texas. we're going to read this line here. So the governor said no more elective surgeries. Okay. Now you would ask yourself, how is that going to hurt them? Again, they were ordered not to do elective surgeries. Why would they reverse course? They can't possibly help them. Let's read this line together. However, it states here that this prohibition, so the banning of the elective surgeries, shall not apply to any surgery or procedure that, if performed in accordance with the commonly accepted standard of clinical practice, would not deplete any hospital capacity needed to cope with a COVID-19 disaster. Okay, so basically, in short, without going too much into it, when they reversed their course and they said, well, hey, now we can take patients, it wasn't that serious, they were stating that the elective surgeries that they were needing to do or that you had scheduled or whatever, basically now they could do them because they stated that it wouldn't interfere with the COVID-19. See, that's the problem. They just bought themselves back into it through this one exception. They said that they would then it's no longer a problem. So that means by this order, this loophole, they could still perform that and still make the money they wanted to make. So I find that a bit despicable. And so anyway, I was going to play the Ron DeSantis thing, but I'm not going to. I'm going to do real quick, we're starting to run out of time here. I'm going to go down to the COVID chart here, and I wanted to show you something here. So I've been tracking the numbers. So this is from 627, the slide, and this is the medical center ICU chart capability, their capacities. Okay, so let's just look at these numbers really quick so that we can show you here. Those are supposed to be their maximum capacity per phase. Phase 3 has 504 beds capacity, 373 phase 2, 1,300 there. Okay, so let's go over here. So this is on the 27th. So this row, again, I've already reviewed this in another slide, but these are ICU bed occupied by COVID, and these are the total ICU beds occupied, period. So here on the 27th, we have 31 and 93, 24 and 72 respectively, 19 and 56. So this is how many beds are actually full. So we're almost, on the 27th, we're almost at 100% there, at 72%, so 3/4 and over half. This doesn't look like they have plenty of beds. Now, at one point, I'm not going to go through all the slides, but at one point, this does go to maximum. They are maxed out at some point, about 2 or 3 days from them, for several days, they were maxed out there. So remember, 56, 72, and 93. Okay, so let's go. This is, of course, for July 5th, which was yesterday, because they're about 1 day behind. Now, notice they've changed the whole structure of this phasing. Look here, phase 1 and 2, intensive care, whatever. It's not phase 1, phase 2, phase 3. They've kind of merged and gotten milky over here. But let's look at the numbers. 98%. Now, remember that, because I do have slides that say full, because they did go to full. 77 and 59, right? So we were at 72, right? And now we're at 77 for today, so it's 5% up. 59, and we were at 56, that's 3% up. Not damning and devastating. Cases are rising, but we just started this thing. My entire point for this is, if they're able to open up new ICU beds like this is saying here, further capacity, and that's great, and they're transferring out to other hospitals like they are transferring to UTMB and Conroe and other places to make sure everybody gets a balanced thing. Why did this only drop from full to 98%? Why did it only drop 2%? This is the lowest level of ICU. This should be the easiest. These are the people that are kind of barely in ICU, and they range from barely in ICU to further up, I'm sure, before they reach a critical phase 2 or phase 3. But this should have dropped 10% if they were really able to manage it, and it didn't. And not only did it not drop 10% and only 2%, these two figures went up. So basically, and if you want to memorize these COVID numbers, more COVID patients are coming in, obviously. So what I'm trying to get at here is that they don't have nearly as much room as they would like to, because the current measures they're doing to stem the tide are barely working in the easiest ICU level they have. And also, we're still showing a steady increase Now, I'm looking more to trend. I'm sure they may have gotten rid of 1 or 2% the day before and then it's back up. But the thing is, the trend from the 27th to now is that they're still running, almost tipping over here, 3/4 of the way there and over half here. I just don't get where all these beds are coming from. And again, it goes back to the statement: we don't have all these beds open. They are basically trying to save their revenue due to the loophole that the governor gave them. That's the exact expression they use. It's the exact reason they did the reversal immediately after he released it, because that opens a window for them to keep their financial and fiscal viability going. Okay, so a conspiracy, no, but definitely not telling us the truth. And again, here the muddling. If we go back to the other slide, really fast. Okay, and if you go and you notice, clearly phase 1 intensive care, phase 2, phase 3, that's fine. And then if we go back to the new one, we see muddle. Phase 1, phase 1 and 2, phase 1, 2, 3. They used to have a pie chart to adequately showed, like, an accelerator on a car or something, a dial, speed dial, showed how close we were to being full. This is totally meant to make it look better. But if you really look at the numbers, it's not looking too good. And we are in the beginning of this, nowhere near the middle. And I think that we are just, like everybody figures, in more trouble than we should be. But nobody's taking the action necessary. They all want to keep us calm, which I can't say that I'd like to see panic in the streets, but honesty can't take a hit here, and it seems to be. Well, let me know your questions and comments. I'd love to find out more information that I don't know to add to this. Definitely, if we have anybody on the inside working in an ICU. My connections, I don't have any ICU connections anymore. I did have some med center connections. I worked there about a decade ago, but nobody's in the ICU at this time, so I don't have any ins. But if you know anybody, I'd love to hear from them, and I promise you they will get on this broadcast. That's all I have for tonight. Thank you, guys.